Medical Monday is sponsored by Beaufort Memorial.
We are here today at Beaufort Memorial with some very exciting news. We're here with the president and the CEO, Russell Baxley. Russell, it's great to talk to you. You guys just broke ground on a new hospital.
That's right, Patty. We did. We're excited to break ground on the Bluffton Community Hospital in Bluffton at Buckwalter Place. It's really kind of a great achievement for us. Long time coming. We're very excited about the future of the organization and our partnership with Bluffton.
And this is going to come to fruition in 2027, or what's the date for it to open?
Well, we hope end of 26.
Great.
All things holding equal with the schedule. We never can predict weather and other delays, but we hope substantial completion in 26, and then we work through licensing. So somewhere in that late 26, early 27 timeframe.
And why Bluffton? Why focus there?
The growth, right? I mean, Beaufort Memorial is the community hospital. We want to grow as the community grows, and Bluffton, as it continues to grow with 40, 45, 50,000 people, does not have a hospital there. And so we're excited to be the area's first hospital to meet that need in the community.
Okay, what are you guys going to offer at the hospital for patients?
Full acute care services, right? We have a full emergency department, lab services, radiology, imaging. We have 4 operating suites with 2 procedure rooms and 28 acute care beds to service the Bluffton community. Okay,
well, of course it'll help the folks in the Bluffton area, but what about people who live in the surrounding areas?
Sure. Well, we know for today we have a number of Bluffton and Hilton Head residents obviously traveling to Beaufort north of the Broad River to use our services. And so we remain a pretty full hospital. And so we want to be able to keep care closer to home. And so what that does is it allows Bluffton patients and Hilton Head patients to stay closer to home while opening up more capacity at Beaufort Memorial for north of the Broad patients to use our services.
Okay, and tell us about staffing for the hospital.
So we will create 250 new jobs year one, and that is all jobs that require a hospital to operate. So housekeepers, respiratory therapists, radiology technicians, CT technicians, obviously nurses, obviously another number of physicians are going to need to be recruited to the area. And so we're excited to embark upon recruiting this new staff and even allowing some of our staff who live in the Hilton Head Bluffton area to also maybe work a little closer to home.
That's great for the economy there.
Today we're about 1,800 to 1,900 FTEs. This will grow us to over 2,000, and then as the hospital grows and as we grow more of our ambulatory network in the south of Broad and north of Broad areas, obviously you'll see that number grow as well.
And what's nice is this is going to be a real community hospital.
Absolutely. I mean, it is built for the community. It is a very efficient, very smart hospital. Focused on really what the Bluffton patient needs.
Russell, tell us about the partnerships that help make this possible.
Well, I think the first and most important partnership we want to talk about is the partnership with Medical University of South Carolina. They've been a good partner with us and for us over a number of years, and they broke ground recently on a new medical office building right next door to our facility. And so we've partnered with them to help recruit more physicians and nurse practitioners and physician assistants to the area in hopes of staffing the hospital, growing both inpatient and outpatient services, and really driving more access to specialty care in the community. One of the things we hear about healthcare in this area is the lack of access to physicians and clinicians. And so partnering with MUSC allows us both to sort of recruit to that acute need, and will really help the community as it grows. Other partnerships, obviously, I'd be remiss without discussing Beaufort County. They are a great partner to us in a number of ways, and they've helped support us in terms of even committing a small financial support to the hospital as well. And so they've been a great partner to us. And then the city of Bluffton, or the town of Bluffton, has been great in helping us work this project through and finally getting there to the groundbreaking.
Okay, what's next for you guys then?
More growth, right? I mean,
meeting the demand.
Meeting the demand. I mean, people are not shying away from moving, to Beaufort, to Hilton Head, to Bluffton. It's one of the fastest growing areas in South Carolina. And so we hope to break ground on the island of Hilton Head on a new freestanding emergency department urgent care hybrid model. And so that's a great next step for us as we grow care further south. And then a lot more primary care access. We're recruiting for primary care needs and also specialty needs. And so really, again, just focusing on that demand for high quality care and trying to meet that demand.
All right, Russell, thank you so much.
Thank you.